all and welcome to my channel. As you all know, I do videos on tuberculosis and recently I am trying to cover all the details about tuberculosis. And in one of my earlier videos, I have discussed about the side effects of antitubercular treatment. There I have discussed 5 common side effects of antitubercular treatment. Here I will tell only one side effect that is very important, that is hepatitis. Friends, hepatitis means inflammation of liver. What happens is, treatment of tuberculosis contain multiple drugs like rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Most of the drugs, they are metabolized in liver. So liver is naturally stressed, and sometimes because of this, liver enzymes get elevated and patient liver function get altered. This is hepatitis, drug-induced hepatitis. Very few patients though present with this type of symptoms, this type of side effects. Otherwise, treatment of tuberculosis is harmless and patient can take the medicine regularly without any interruption, without any problem. So when patient's liver enzymes get elevated, sometimes patient doesn't have any complaints, any symptoms. Without any symptoms, there is transient rise of liver enzymes and transaminases. But this problem happens during the first 2 or 3 weeks of treatment, as soon as the patient is put on antitubercular treatment. But after a few weeks, these liver enzymes become normal and patient become totally normal. There is no problem, so patient can take the treatment without any interruption. In some cases, this problem becomes more evident. Patient develop some symptoms like anorexia or loss of appetite, malaise, then general weakness. Patient can develop tendency of vomiting and jaundice. As you all know, jaundice is yellow discoloration of conjunctiva. This type of symptoms when appear, we usually admit the patient and treat the patient for hepatitis, and we assess the patient. If needed, we stop the treatment of tuberculosis. Sometimes some patients develop more severe symptoms like protracted vomiting, then mental changes, jaundice become more, and this patient need immediate attention and immediate discontinuation of antitubercular treatment. This type of symptoms actually develop when liver function is very much impaired and patient develop acute liver failure. In that condition, there should be immediately discontinue the this antitubercular treatment, and patient can be admitted and treated for acute liver failure. Now, few important points you have to remember. When the treatment of tuberculosis will be stopped and when the treatment will be started again, that will depend on the assessment of doctor. We have to stop the treatment at least till the jaundice disappear, patient the liver enzymes come to normal level. Till then, we have to stop the treatment. Then, few causes of hepatitis we should rule out, like viral hepatitis. There are incidents of viral hepatitis and causes like hepatitis A, hepatitis B, hepatitis C, and B, and so on. These viral hepatitis, incidence of these hepatitis are increasing in India. So we have to do all the investigation that whether patient is having viral hepatitis or not. And other causes of hepatitis, maybe alcohol induced or some other causes, that also we have to assess. Because if the patient is having hepatitis because of some other reason and we are diagnosing as drug-induced hepatitis, then there will be a mismatch of diagnosis and treatment. So we have to do the investigation and we confirm that this patient is having drug-induced hepatitis. And the third point you have to remember is, when there is no facility to do liver enzymes, in that situation what we have to do? In that situation, we will stop the antitubercular treatment till the jaundice disappear, and again another 2 weeks we'll add to that, and after 2 weeks we consider reintroduction of the antitubercular treatment. So jaundice has to disappear, and again another 2 weeks we have to wait because we don't have facility to do liver enzymes. Now patient had hepatitis and we have treated, and now patient's hepatitis is totally cured. Now patient is totally stable. Now we have to reintroduce the antitubercular treatment. Regarding the reintroduction, we have to assess the patient's condition, and we can introduce the multiple drugs one by one. Though I prefer to introduce one by one, so that the patient suddenly is not exposed to multiple drugs. And if patient had acute liver failure, patient had a severe problem in the liver, in that situation after recovery we should consider to omit rifampicin. We can continue with streptomycin, ethambutol and isoniazid. So that is more preferable. Friends, that's all about hepatitis due to antitubercular treatment. Thank you for watching this video and stay healthy.